All right, welcome everyone. Thank you for attending today. My name is Dr. Jason Martin, and I'm a critical care doctor in Sumner County, Tennessee. I've spent the last year of my life, more than that really, treating patients with COVID-19 on the front lines of this crisis. I've witnessed hundreds of deaths from COVID-19 in that time, and each one has been painful and personal. I held up a lot of iPads while moms and dads and brothers and sisters wailed and watched their loved ones die remotely, while I held the hand of the dying patient with my other hand. And all of these deaths are tragic. What's particularly tragic, though, is that the deaths that are occurring now are preventable. They're preventable with a free, safe, and simple vaccine. I have several folks in my ICU right now with life-threatening COVID-19 infections. And as recently as yesterday afternoon, one of them was crying on my shoulder, wishing that they had had the vaccine before this had come to pass for them. And now they're facing the possibility of death from a preventable disease process. You know, there are dozens of stories that I could tell you from the last year and a half, but the one that haunts me the most was when our team had to call a young girl in the middle of the night, the only English speaker in her family, and tell her that her dad had died. I have a daughter her age, and I will never forget the anguish that I experienced in that moment. Can you imagine what it felt like for her to receive that call and have that burden of having to tell her family that daddy's passed away? It's those stories and the dozens of others that we could tell you in painful and vivid detail that compel me and others to speak out against politicians and policies that endanger us all. Because suffering like this is entirely and completely avoidable at this point. Unfortunately, Bill Lee has repeatedly undermined health professionals from the beginning of this pandemic, abdicating his responsibility to lead. His fend for yourself approach shifted the burden of a global pandemic to mayors and parents and teachers and business owners. And now, unfortunately, we see more of the same from Governor Lee and his administration. In the name of partisan politics, he's acting to suppress vital, life-saving public health guidance, firing our state's top vaccine employee just for doing her job. And it's for that reason that I'm calling on the Justice Department to launch an immediate investigation into Bill Lee's reckless misconduct, his dereliction of duty, and his abuse of office that is endangering the lives of Tennesseans and endangering our state's economic recovery. My hope is that our state will, in good faith, not halt normal vaccine programs and outreach, and that normal childhood COVID immunization will continue. I'd like to share some excerpts from my letter to the Justice Department. No matter where we live, no matter the color of our skin or the brand of our politics, we have seen over the last year how the health of one person affects the health of the person next to them and the person next to them. Instead of going all in for us here in Tennessee, Governor Lee has undermined the medical community, suppressed vital life-saving health guidance, and now he has fired one of the state's lead physicians, Dr. Fiscus, simply for doing her job, educating the public on vaccine preventable diseases and immunization programs at the Tennessee Department of Health. The result of Bill Lee's reckless misconduct and abuse of office have prolonged the COVID-19 crisis and led to entirely avoidable school and business closures, entirely avoidable hospitalizations and deaths. Now, as most of the country increases their vaccination rates and aids their own economic recovery while protecting the lives of the citizens who are most vulnerable in their states, Bill Lee is further politicizing the health crisis and endangering Tennesseans' lives and jobs. Tennessee now lags the country in vaccinations as the dangerous Delta variant takes hold and school reopening approaches. Instead of doing his part to help schools reopen safely, it has been uncovered that Bill Lee has instructed the health department not only to suppress health guidance on COVID-19, but suppress vital life-saving public health guidance on all vaccine preventable diseases. This extremist partisan attack on public health and safety must be investigated. People need to be held to account. I am pleading with the Justice Department, launch an investigation into Governor Bill Lee's reckless misconduct that is endangering the lives of Tennesseans, lives that me and my colleagues took an oath to protect. Today, with entirely safe and reliable COVID-19 vaccines available, and countless studies demonstrating efficacy of mask wearing as a mechanism for slowing the spread of COVID-19, the biggest threat to the health and well-being of Tennesseans' lives and our economic recovery is Bill Lee's further political attacks on public health and safety. Let me say again, my hope is that the state of Tennessee will, in good faith, not halt normal vaccine programs and outreach, and that normal childhood COVID immunization can continue. Thank you.
We'll now open it up for a few minutes of questions. If you have a question, you can raise your hand on Zoom, and we will unmute you and open up for questions. You can also use the Q&A box as well. All right, Kimberly, you are unmuted.
Hi, this is Kimberly with the Associated Press. I guess, and I apologize, I joined a little late, but I know you're calling for an investigation. I mean, I guess I'm confused as to what Governor Lee has done illegal here. I mean, outside of, yes, raising eyebrows here, but I'm curious, like, what you think the DOJ can investigate.
Right. I mean, when you're an employee in the executive branch, you serve at the pleasure of the government. You can be fired for any reason, but I don't think that you can be fired for an illegal reason. And I would like to ask the Department of Justice, is it illegal to discontinue behaviors and policies that are saving lives? Like, is it okay to stop promoting interventions that are going to save people's lives? Should he be held to account for the inevitable consequences of those actions? And I think that's worth investigating. It's certainly worth asking the question of people in the know.
Thank you.
All right, other questions? Feel free to use the Q&A box or raise your hand on the Zoom as well. Okay. Not seeing any other questions. It's yours to close. Oh, wait, 1 second. We do have one. Typed in question. How do you plan on pressuring Governor Lee to reinstate vaccinations for children?
How do you plan on, can you say that again for me, please?
The question is, how do you plan on pressuring Governor Lee to reinstate vaccinations for children?
Yeah, so I think what we need to do is we need to educate the public about the safety and efficacy of these vaccines. And the public needs to demand that they have the appropriate resources from the state. Look, government is here to help us solve big problems, right? COVID-19 is the biggest problem that we've faced in public health in our lifetimes. And so for us not to use the tools of government to solve this problem and to help get over this problem is a travesty of justice. And so that's why I think the public needs to stand up and demand that Governor Lee does the right thing.
Not seeing any other questions. It's yours to wrap it up.
Yeah, I'd like just to add one additional comment. You know, Bill Lee continues to suppress vital life-saving public health guidance that is going to prolong this crisis. It's going to make it harder for Tennessee to get back to work. It's going to be harder for schools to open safely this fall. And so if you want to make progress on this pandemic, Governor Lee needs to have all hands on deck. He needs to be promoting this vaccine. You know, if I, as a clinician, withhold life-saving therapies from my patients, I suspect there would be some liability there. And so I think it's fairly reasonable to assume that he has liability for his actions as well. And it's not okay to withhold life-saving interventions from folks. It's not. And that's why the physicians in this community are going to stand up and speak the truth.
All right. Thank you, Dr. Martin. Thanks to everyone for being here. We will circulate a recording of the call afterwards, along with Dr. Martin's letter and the signatures of his colleagues.